Hi, and thank you. First of all, thank you for awarding me the funding, and also thank you for the opportunity to present an overview of my research today. The study formally starts in April 2021. However, I'm continually monitoring developments. I'm going to start with a bit of background about the research, followed by an overview of the study design, and then I'll discuss some of the challenges and potential impacts. So the study emerged out of discussions with professionals and volunteers working on the front line of the COVID-19 response when the pandemic emerged in spring. And these were areas of high levels of socioeconomic disadvantage. And now we know that people living in disadvantaged circumstances face greater risk from the disease itself, and that the lockdown and policy response from the COVID-19 pandemic have unequal impacts, such as increasing social isolation, domestic violence, food and digital poverty, and unemployment. And during this response, stakeholders from the charity sector described a frustrating relationship with statutory agencies who relied on them initially to mobilise resources, but then withdrew from the relationship once they had their own systems in place. And there were also heartbreaking stories about how charity workers and volunteers were supporting or meeting the needs of people falling through the cracks of the official systems and processes as well. And then stakeholders and statutory organisations also described difficulties coordinating the emergency response within and between the organisations at the local level, and also the challenges of responding to a continually shifting and volatile national policy context. And my research had made me aware of the inherent difficulties of multi-agency partnership working, particularly in public health. So I began to explore what plans local resilience forums had in place in preparation for emergencies like the pandemic, and to formulate research questions. So local resilience forums are multi-agency partnerships between local authorities, the NHS, emergency services, and others. Their role is to prepare for and respond to emergencies in the local area, and I'm particularly interested in work aimed at mitigating the impacts on disadvantaged groups. So the long-term aim of the ResNet study is to inform the design of a larger study that would be the subject of a postdoc fellowship application. The aim is to contribute evidence to improve the effectiveness of action of local resilience forums, to reduce the impact of public health emergencies on disadvantaged groups. So the pilot study will enable me to extend my policy and practice networks, conduct a scoping review of the literature, assess the feasibility of the research, including the collection of local secondary data, and undertake interviews with local stakeholders. I'll then use this data collected to refine the questions to be addressed in the larger study, and also the study design. Two contrasting local resilience forums have agreed to participate in the study, one with a relatively high score on the indices of multiple deprivation and one with a relatively low score. And finally, I just wanted to touch on the challenges I might face. So in the context of the ongoing COVID-19 pandemic, and potentially new local emergencies arising from Brexit, such as food shortages, local resilience forums are likely to face a continuing volatility in the national policy context, which could impact on the propensity and capacity of participants to take part in the study. Also, working in an online environment could make it more difficult for me to establish and maintain relationships in fieldwork sites. On the plus side, the pilot study could illuminate ways in which local resilience forum could improve their work to support the most disadvantaged populations, and this can be immediately communicated to local authority policymakers and practitioners. And in the longer term, the evidence from the larger study will support local agencies to prepare together more effectively to respond to future public health emergencies, with an approach that is sensitive to social and health inequalities. So to summarise, the study emerged out of discussions with stakeholders working on the front line of the COVID-19 response. The funding will enable me to build on these discussions through the pilot study and develop a robust proposal for the fellowship. And although there are significant challenges, the outputs have the potential to influence policy and practice at the local level. Thank you again for inviting me to present a brief overview of my research.